Hi everyone, my name is Sona Irapayan. I am a nurse practitioner student at United States University. Today is November 17, 2025, and this is for Nursing 572 course. Before we get started, I am going to do a 360 view of my workplace. It's me, my patient. Oh, I have to be in it. My patient, the floor next to my patient. Floors, ceiling. I think this was enough of a 360. Okay, she's visible. Okay. So before we get started, I'm gonna knock. May I come in? Yes. I'm gonna give her some privacy. I'm gonna walk to the right side of my patient. And before we get started, I wanted to see if it's okay for me to record this examination. I'm going to do an abdomen examination. This is going to go on YouTube. It is for my professor to see and grade, but it will be on YouTube. May we continue? I have your permission? Perfect, thank you. Before we get started, can you please state your first and last name and your date of birth? Thank you so much. Do you have any allergies? No. Perfect, thank you. I'm going to do hand hygiene. And I'm checking my environment. Everything looks good. So just a little introduction of what we're going to do. I'm going to do an abdominal examination, but before we get started, did you get a chance to empty your bladder? Perfect, so it's not full? Okay. And I'm going to do some touching. If you feel pain at any point, please let me know and we will stop the examination. Do you have any pain now? No. Okay. So this examination is going to include 4 parts. It's called inspection, auscultation, percussion, and palpitation. So inspection, I'm just going to use my eyes. Without auscultation, I'm going to use the bell and the diaphragm of my stethoscope. I'm going to listen to your abdomen area, and then I'm going to do some touchings. So before we continue, may I lift your shirt? Okay. I'm going to lift your shirt to expose your abdomen. So here we go. I'm going to give you a blanket for privacy. And you are in a supine position. Your head is on a pillow and your legs are comfortable. You're good? Okay. And so I'm looking for, on your abdomen, I'm looking for your contour symmetry. It looks good. There's no discoloration. Its skin color is appropriate to ethnicity. Your abdominal appears flat and symmetrical. There's no bulging, no masses, no bruising. No scars are present, and you have no masses, and there's normal movement, which is peristalsis. I'm going to go ahead now and check your eyes. I'm checking for jaundice, which is yellowing of your sclera. The sclera is the white part of your eyes. There's no yellowing of your eyes. It's normal, clear, white color. There's no redness, and one of the reasons why I check that is if there was some yellowing, it would possibly be an indication of like some type of liver disease or something going on with your liver, which we're going to go ahead and check later on in this exam. Do you have any questions so far? Okay. And as I mentioned, you do look, your color is appropriate to your ethnicity. And we're going to get started. So I'm going to use my stethoscope. As I mentioned, I'm going to use the bell and the diaphragm of the stethoscope to listen to your abdomen. I'm going to start by listening to your right lower quadrant of your abdomen, and I'm just gonna move around and I'll verbalize where I'm at. So I'm listening. So before I get started, for this exam, I'm typically supposed to listen 30 to 60 seconds on each quadrant. However, for this exam, we're just gonna assume and I'm gonna verbalize that we did that. So I'm listening to the right lower quadrant. I'm moving up to the upper right quadrant, left upper quadrant, right, left lower quadrant. Perfect. So we're going to assume that each quadrant will listen to for 30 to 60 seconds. And upon auscultation, I did hear some gurgling and crackling. That's all normal. It just means, and there were about like 10 to 20 times per minute. And that is normal, which is it's within its normal limits, which is I think 5 to about 34, 33. So we're normal. We're all good. Do you have any questions so far? No. Now I'm going to listen to abnormal blood sounds, and I'm going to use the bell, and this is the bell, and the abdomen. Was the stethoscope, the bell, and the and the diaphragm? Was the diaphragm and the bell cold upon touch? Okay, perfect. So we're going to start with the aorta, and then we're going to look for the zygote process, which is located 2/3 2/3 down of your umbilicus, and we're going to use the bell and the diaphragm of my stethoscope. You ready? Okay. Sorry. Perfect. Now we're going to move to the renal arteries, and they're located about 3 centimeters superior and lateral to your umbilicus. You ready?
Yes.
And we're going to listen to both sides again. And we're going to use the diaphragm and the bell to listen to this. So anything that's vascular, I'll verbalize it, but we're going to use both the diaphragm and the bell. Okay. 3 centimeters inferior. Okay. So perfect. So for both the renal arteries and the iliac arteries, I didn't hear any bruise, and everything was normal. That's exactly what I needed to hear. I wasn't supposed to hear anything as far as like bruise go. So we're good on that. Now I'm going to listen to your femoral arteries, which are located midway of your aces and pubic symphymus. So for this exam, typically I would ask you to lower your pants. In your case, your pants further down so I can get it. But for the purposes of this exam and this video, we will keep you closet for your privacy. But I will go ahead and listen to your femoral arteries now. And again, I'm using the diaphragm and the bell for them. Are you feeling any discomfort?
No.
Any pain?
No.
Again, no bruise noted, so everything sounds good. Now I'm going to move on for percussion, the percussion process, and this is exam I'm going to be touching your abdomen. And again, is that okay?
Yes.
So it's going to be a gentle tap on your abdomen. I'm going to be using one hand on all 4 quadrants. What I'm trying to hear is I want to make sure that I hear tympani and not dullness. If there's dullness, then we can discuss it. So here we go. Any pain?
No.
No pain?
No.
No discomfort?
No.
Okay, so as I mentioned, it was a tympanic sound. There was no dullness. I'm going to go ahead and percuss your bladder again. See your bladder, this uterus bladder. Again, it's tympanic bladder. If it was to be full, I would get a dull sound, and that would mean you lied to me. You didn't to go ahead and check your liver. We're going to start with the mid-clavicle line, which is near your belly button. And we're going to move upwards. Once I hear dullness, that would be like the lower border of your liver. So we're going to go ahead and do that. And once I get to that lower border, I am going to use, that's a ruler, that's a pen. I'm going to use my pen to mark your abdomen. Do I have permission to make a marking? Perfect. So I'm going to move. Are my hands cold?
No.
Okay. I'm going to mark it. Then I'm going to feel it. Okay, I'm going to use my ruler to measure. Okay, so it's about 8 centimeters, and it's those distance within the borders is appropriate because the normal range is 6 to 12 centimeters, so you're okay with as far as the location goes. Now I'm going to tap on your spleen, which is at the left, which is located right underneath your ribcage on your left side, and it's underneath like the 10th intercostal space. And what we're trying to do is we don't want to feel your spleen. And again, your liver here, when we first start palpating on the right side, we can feel it, but once we get closer, we're not really the liver or the spleen. So I can't feel the spleen. I'm on the 10th. Yeah, so there's tympani sound, and there was no dullness, which is a good thing. It's not indicating a large spleen. In that case, it would be considered an emergency, and it's called a splenomegaly, which is a term for enlarged spleen. And as I mentioned, that would be emergency. So now we're going to go ahead. I'm going to move to palpitation, where I'm going to gently press on the abdominal. So I'm going to do it once with one hand, and then the next time I'm going to do it with both hands. I do still have permission to touch your abdomen, correct? I'm going to use one hand, and I'm going to lightly, I'm checking for tenderness, I'm checking for mass, I'm checking for like pain, any guarding, anything. Okay, now I'm going to use both hands, and again, I'm going to check masses and see if there's anything. Any pain?
No.
Okay, now I'm going to feel the border of your liver. If you can take a deep breath for me. Let go. Okay, I'm checking the liver border. The edge is not palpable, which is a good sign. That's normal. I'm not supposed to palpate it. Now I'm checking your spleen. So again, I can't feel the spleen. Upon palpation, I'm going to check your appendix, and your appendix is on the lower right side. I can't. Okay, we're good. And I'm going to check your colon, which is on the left side. Do you feel any tenderness, any pain? There shouldn't be anything. Am I too rough?
No.
Okay, perfect. We're going to start our specialty tests now. Do I have permission to go ahead and do that? Beautiful, thank you. So the first test, I'm actually going to need your participation, if you would please. It's called a fluid wave test. I just need you to put your arm in your midway, just one of them, please. Okay, just press like with that, just press on it. Okay, I'm just going to see if there's any fluid. I'm checking for any ascites and any fluid in your abdomen, and it's negative. There is no movement, so that's a really good thing. Our next test is going to be, our next test is going to be the Murphy's test, and this is where I'm checking to see if there's any gallbladder enlargement, and that test is really, it's used for cholecystitis, which is enlargement of the gallbladder. But fun fact, I'm postpartum, and I just had a baby, and my OB said that that's pretty common after childbirth. So Just a fun fact. And again, cholestasis is the inflammation of the gallbladder. And I'm going to ask you to take a deep breath. Breathe in and out for me. One more time. Do you have like an urge to stop?
No.
Okay, perfect. That you were good. It's negative. Next, I'm going to do the road sign, which will be checking for your appendix, for your appendicitis, and you might feel like a little what's it called? A rebound pain, and if you do, then you be positive and we can discuss. So I'm gonna push down on your left side of your left lower quadrant, and I'm gonna withdraw it. Any pain?
No.
Okay, perfect. Now for this part, I'm just gonna help you cover up. If you can please have a seat. It's the last specialty test. So we did Murphy, we did row signs. Okay, and we did check your gallbladder. Okay, the next last test is called a CVA, and it's a CVA tenderness test to check for polynephritis, which is inflammation of the kidneys. I'm going to have you sit up, which you did, and I'm going to place one hand and between the bottom of your rib cage and your 12th rib meets. I'm going to do it on both sides. I'm going to strike with my fist closed onto my arm. You shouldn't feel any pain. Do you feel anything?
No.
One more side. Any pain?
No.
Okay. And since you don't report any pain, then this is considered a negative test. And we are done. Thank you, Professor. Thank you, Ash.